peripheral blood smear shows the presence of schistocytes. Okay, what is the most likely diagnosis? 3-year-old girl brought to the pediatrician by her mother due to lethargy, pallor, decreased urine output. She recently had an episode of bloody diarrhea. Okay. To me, that screams like E. coli with a kid. Lab test showed anemia, thrombocytopenia, increased serum creatinine, peripheral blood smear, so schistocytes. I think it's HUS right off the bat. I would say, yeah, hemolytic uremic syndrome.
Good. Perfect. Worked through that beautifully. So, just kind of um, to roll this into kind of one lesson or thought process here. What's the difference between HUS and TTP?
Um, so HUS has to be from it's usually like kids E. coli. TTP and ITP, I get always a little confused. One of them is one of them is confusion. I
Okay.
think,
Yeah,
I
you're on the
think
right
that's
track.
TTP
Yep. TTP is with confusion,
with
neurologic.
confusion.
Yep.
Yeah,
And
and
there,
then ITP and TTP also usually have like nosebleeds,
yes. So the way
stuff like
you want
that.
to study these two is these two should be in sync. Okay,
Okay.
HUS and TTP, they're very, very similar. The only difference is that TTP usually has neurologic symptoms as well as the hematologic issues, right? ITP, immune thrombocytopenic purpura, you have like an infection first, like an upper respiratory infection, which is the inciting event, and then your body fights the virus off, or virus or bacteria, but also kills your platelets in the process on accident. So you
Okay.
just have really low platelets here, right? Which obviously can cause bleeding, right? Like nosebleeds, petechia, things like that. DIC is the one that everything's out of whack. All your factors are messed up, right? Your
Yeah,
platelet,
elevated D dimer,
yep, D
elevated, I
dimer,
think. I think plasmin might be elevated in
yeah,
that one.
and
Everything else is off.
and you have spontaneous bleeding everywhere, right? Like your IV site,
Yes.
your nose, everywhere's bleeding, and then acute glomerulonephritis. That's renal. That's not going to really deal with this right here.
Okay. So HUS and TTP, you're saying, so TTP can be from bacterial illness like that?
Yeah, it's usually
It can progress to that?
no, it has similar symptoms, is what I'm saying, but it's from the
Okay.
Adams T13. The reason why you
Okay.
learn them together is because they're like, let's say they for some reason gave you all these same symptoms without much else, and the only difference between these two is neurologic. So if they have a neurologic sign,
Gotcha. Gotcha.
TTP.
Gotcha.
If they don't
Okay.
have it, then it's HUS. But yeah, like
Okay.
you said, usually for the most part, HUS is going to be from like, E. coli GI issues or something like that.
Okay.
But you want to learn these two together because they're so similar and only one thing changes, and that's neurologic symptoms.